Welcome back again. Good to have you here with us. So today's video is about a very cool and important topic. A lot of my patients, when they come for consultations, they ask me, well, am I going to have pain during the procedure, the hair transplant? How do you numb the area? Do I get put under general anesthesia? All these questions. So if you're curious about that, let's talk about it. Stay tuned. And again, if you like the content that we're putting out, please click the like button down below. Subscribe to the channel, and we would appreciate that. Okay? Let's go and start talking about anesthesia. All right, so today's video is about anesthesia. How do we keep you from having pain during your hair transplant procedure? Very important topic. It's not really talked about very much because most people are kind of like, well, am I going to hurt? How are we going to be doing this anesthesia? Am I going to be under general anesthesia? What are the risks of this? So I thought I would put this video together to kind of clarify these concepts for you. So normally anesthesia is used in hair transplantation there's two types, really: general anesthesia and local anesthesia, right? So general anesthesia is what you get when you go to the hospital, when you get your gallbladder removed or any procedures like that. They'll put you under anesthesia, they'll give you some gas so you can breathe, and that'll keep you sleeping and comfortable for the entire duration of the surgery. It's very safe, it's done all the time, but usually requires a hospital setting or an outpatient surgery center or some kind of facility like that, because the risks of that anesthesia are much higher. In hair transplant surgery, back in the day when I started doing this, I don't know, almost 25 years ago now, a lot of the doctors, particularly outside the US, were doing the procedures under general anesthesia. So they had an anesthesiologist in the room that will keep the patient completely knocked out for the hours and hours of the surgery. I've always done it under local anesthesia, so I never saw the need for general anesthesia. Patients do very well with local, the way that we do it, but that's how it was done in a lot of places. Nowadays, in the modern era, I don't know of anybody that does general anesthesia anymore for hair transplant surgery. It's really not a necessity. And again, the risks of that anesthesia kind of increases, particularly because hair transplants are very long procedures, a few hours. And the longer you are under general anesthesia, the higher the risks for your health. So there's really no need. We do procedures all the time, every day, under local anesthesia, and patients do very well. The most common anesthetic that we use is called lidocaine. There are other ones that we use in certain cases, but it's very safe. It's what people use during the dental procedures that you go to, or if you go to do a biopsy on your skin on your dermatologist, they're going to numb the area with lidocaine. Very safe, very effective, very quick anesthetic. Of course, we have to be careful. There are some things we need to watch for, but of course, I'm very well trained in that, and we have strict protocols that we follow for safety during the anesthesia. With the lidocaine anesthesia, you're not going to have any pain. Your scalp will be completely numb, but you'll be awake. It will do give you a little something to relax, but for the most part, you're really, really relaxing. You're talking to us, you're watching movies, and you're not having any pain at all. So it's a very comfortable way to anesthetize the scalp. So this is just a little bit of information. This is a slide that I use for when I'm training students and doctors and stuff, but the nerves in the scalp, just so you understand, the nerves in the scalp come from the neck up. There are specific nerve bundles that are the most important nerve bundles that we need to numb or anesthetize. We can do nerve blocks. That's another type of local anesthesia, or we actually block these nerves, right, where they come out of the skull, right? And so that if we block them at the root here, for example, everything above there will be numb. I tend not to use nerve blocks unless special situations. I know how to do them, but I don't prefer them. What I do use is what we call ring blocks. So I go around the area where we're gonna do the transplant for you, and we numb that area. So for example, in this patient here, we would anesthetize in front of this purple line here, do a ring, eventually come around here, the lower part of the donor zone, and so the entire scalp will be numb. If I anesthetize the lower portion here, everything from that point up will be numb, right? So I don't have to apply anesthesia to every skin surface That's important because if I had to do that, that would increase the dose of lidocaine to a point where it will be actually toxic and dangerous. So doing the ring block or the nerve blocks provides very safe and very comfortable anesthesia for you. Lidocaine goes to work immediately after you inject. A couple of seconds, you already don't feel pain. It lasts for a few hours, usually 4 to 5 hours or so before it starts to wear off. So there are longer lasting medications that we also use during surgery to keep you comfortable. So what we do is periodically we re-inject the area as your body absorbs the anesthetic. We kind of reinforce the ring block so that you can stay comfortable. Okay. My goal for every patient is to leave the office with no pain. And so with the anesthesia that we do, the technique that we use, you go home or you go back to the hotel if you're from out of town, out of the country, and then you're not going to have any discomfort for that evening, really, you know. So the anesthesia doesn't wear off until later in the evening. So it's very comfortable that way. There are some special situations where we have to use a different way to apply the anesthesia. So for example, here in the picture you see, oh, I can't see, but this is the chest of a patient. So he's lying on the table and I shaved the chest hair, so I'm removing chest hair for FUE. In large areas like that, where you have a different way of numbing or anesthetizing, we use what we call a modified Klein solution. You don't need to know details about that, but it's basically, Dr. Klein was the one that invented what we call tumescent anesthesia. He's a liposuction doctor, one of the most important doctors in that field. And he published a few years ago this solution that he compounded, that he put together, that has, basically saline solution in a bag. You put some lidocaine in there, and then you inject that into the tissue, and it numbs. Because the quantity of lidocaine is relatively low per volume of the solution, you can use a larger amount and numb a larger area without risk of toxicity. So we use that for certain situations. Another way of anesthetizing, there's another solution in the market which has basically bupivacaine, which is similar to lidocaine but has a longer lasting effect. It's called Marcaine, that's the commercial name. But what they do is they put it inside these little fat globules. So it's called liposomal bupivacaine, right? So what that does, if you inject it into the patient or inject it into the scalp, that little fat globule will slowly dissolve away and release the anesthetic over a few hours. So patients with this solution can get anesthesia for about 72 hours, really, So it's a much prolonged anesthesia, very safe as well. Is used very commonly, and we use it here in certain situations as well. Patient experience, that's one thing that I pride myself on offering. Because I've had surgeries before, transplants myself. I've been doing this again for almost 25 years now. I want to provide you with the best experience possible. Of course, the results are going to be important, obviously, at the end, but I want to make sure that when you leave the office after the procedure, you tell me, well, this was easier than I thought. I was very comfortable. So we make sure that you are staying in a very safe environment. This is a picture of our main operating room. Everything is sterilized. Everything is very safe for you. We keep the office pretty cold. I think most people understand that doctors' offices are very cold because we're wearing masks and gowns and paraphernalia and loops and everything. So if we don't keep the office cool, it kind of makes us feel uncomfortable. But we have disposable blankets for you, and so you make sure that you're warm and in a good, a comfortable position. This is basically how you're going to be for most of the procedure. Recline on this comfortable chair. You see the team working back here. I'm working on the top. Right here on this wall, there's a TV. Maybe you recognize him. I don't know how well the camera can grab it, but this is Jimmy Hart. If you're into wrestling, you know who he is. The Mouth of the South. He used to be a pretty big wrestling promoter and everything. So he's a good friend of mine. We've done a couple of surgeries for him in the past. But anyway, that's kind of what you're going to see. There's some snacks here if you get hungry. We got some water, soda, and everything like that. So all designed for your comfort. On the TV here, we have Netflix, other movie channels, news and whatever. I tend to tell patients not to watch the news because they can get worked up if there's something happening. But anyway, we try to keep it very relaxed. We do monitor the patients. That's very important too when you're doing anesthesia, local or otherwise. We want to make sure that we are comfortable there and safe. We have these little heating units. Like I said, we keep the office cold. if the blankets don't do the job, we can put you in this little heating unit. It's called a bear hugger, so it's pretty cool. It gives you nice, blows hot air under a blanket that kind of inflates, and so it's very nice and it works really well too. So in conclusion, nothing to be afraid of, right? Anesthesia for hair transplant is very safe. We do it very slowly. There's no pain, very little discomfort. Once you're anesthetized, you're not going to have any more problems. The whole day, your scalp will be numb, and we'll be working on it. And we keep proactively reinforcing that ring block because we want you to not to feel any pain, you know. So, but the procedure, it again takes a few hours to do. You can get up and go to the bathroom. We serve you some lunch. There's some snacks as we saw here. And then at the end of the day, you'll get up and you go to the hotel or go home and you'll feel very relaxed and comfortable and pain-free, okay? So this is it. If you want to talk a little bit more about this, feel free to give me a call. We can schedule a free consultation. I'll give you an evaluation and see, and we'll talk about all this in more detail, okay? If you have questions, write them down in the comments below. Please click the like button if you enjoyed this video. We appreciate that. Subscribe to the channel so you can get the other contents that we put out. And I'll look forward to seeing you next time. Take care.